First, effective immediately, the FDA will be notifying physicians that the use of let's see how we say that. Acetaminophen. Acetaminophen. Is that okay? Which is basically commonly known as Tylenol, during pregnancy can be associated with a very increased risk of autism. So taking Tylenol is not good. All right, I'll say it. It's not good.
Welcome back. Last week, President Trump claimed that acetaminophen, the main ingredient in Tylenol when taken by pregnant women, particularly in late pregnancy, is linked to autism.
And despite expert warnings, no publicly released study shows Tylenol as a direct cause of the disorder. Returning today to discuss this hot-button issue is Dr. Stephanie Hack. Dr. Stephanie, thank you so much for joining us.
Thanks for having me.
Now, break it down for us. What is Tylenol? What are some of the things that Tylenol helps with, and why do pregnant women normally go for it? I know it's only maybe the one thing that you can take when you're pregnant or nursing.
It's like the one medication that we feel safe and comfortable giving pregnant women for fever, for pain. Tylenol, if you have a muscle ache, if you have a cold, all of these things are reasons that we might potentially recommend you take Tylenol.
And why is Tylenol the one thing that, or just the most thing that doctors actually trust other than the other pain medications that you can take during pregnancy?
Sure, it has the best safety record. So there are other medications that we know that can help with fever and pain, like ibuprofen or Motrin, aspirin. Those are NSAIDs, non-steroidal anti-inflammatory drugs, but those have other effects and things that we know, the complications that they can cause in pregnancy, especially later in pregnancy. And those are things that we really want to avoid. And so Tylenol has the best safety profile during pregnancy.
And what are some of the things that research actually tells us about Tylenol and child development?
That's excellent. I think the best thing is what research doesn't tell us. And research does not show that there is a cause. It does not show that Tylenol causes autism. Now, there have been, as was mentioned before, some associations with autism, but again, association and causation are not the same thing.
Gotcha. So let's talk a little bit about what President Donald Trump, went on record to say. Is there any truth to it? What can you tell us?
Sure. So some studies have shown an association, other studies have shown no association, and even other studies have shown it to be protective almost. So we see a lot of different information being presented, but when all of them come together, the one thing that everybody points out is we need more research. What we have now is not enough to tell us that there's a cause.
And I'm a mom myself, and I know that there are some moms out there that may feel scared hearing all these headlines. So how should they balance facts and fears?
Sure, it is scary, and it's a lot of information to sort through. But I think the main thing to remember is that Tylenol is still considered safe in pregnancy. And then for that balance, always talking with your OBGYN, talking with your midwife will give you a sense of relief. And again, as far as social media is concerned, you want to have the conversation with your expert healthcare provider.
Gotcha. Now, are there any natural or non-medicine options that pregnant women can try before taking Tylenol?
Of course, especially for things like pain, you can try rest and relaxation. For muscle aches and pains, you can try massage or like cold compresses. But even when you do all of those things, for example, like with a fever, you still may need medication to bring that fever down.
And what kind of advice would you give to pregnant women about finding trustworthy information on this topic?
Sure. I would always say, again, start with your OBGYN, start with your midwife. That's where the conversation should begin. Take what you see on social media with a grain of salt. You always have to confirm, and you really want to go to the experts. And again, trusted medical groups like ACOG, the American College of Obstetricians and Gynecologists, give great guidance.
Gotcha. Now, is there a safe amount of time or a time limit that you can go with while taking Tylenol while pregnant?
Sure. Again, I think it's the same kind of recommendation that we give for any medication that you take. You want to take the smallest amount for the shortest period of time, and that's the good rule of thumb.
And will Tylenol have a different effect on babies that are being nursed?
No, it's the same. It's still, the safety profile is still considered the same.
All right, well, thank you so much, doctor. We really appreciate this information.
You're welcome.
And for more information on women's health and Dr. Hack's podcast, we want you to visit ladypartsdoctor.com.